Dr. James. How are you doing?
I'm doing okay. I'm still stressed out from
Well,
Friday.
you're stressed out?
Yes, totally stressed out because of everything that happened. You I never seen this doctor before. He didn't even come and see what my well-being is or nothing, and just was talking to me crazy. I'm like,
Yeah.
I'm totally stressed out.
You, Dr. Smith.
Yeah. So yeah. So I mean, what is the status? What is going on?
The discharge order is still in. Has the appeal gone through, or?
Um, I think I all called. I think they said it was denied, but I'm not for sure. But I mean, this if you guys can give me a fair chance, I mean, this is the thing. I looked up, and you took them to places. They refused the places. That's not fair.
After we spoke yesterday, I sent a message to Simon with everything you gave me, the names of the facilities, the contact people, phone numbers, and said, can we speak with these people? And he spoke with his supervisors, and they said, no, we've already done a search, and we're not going to extend the search further. So I asked.
So, could you give me a referral?
I can generate the typical process that we use for getting people to a rehab center. Really, is going directly from a hospital to the rehab facility. I do write prescriptions for outpatient physical therapy on a regular basis. That's where people go to a facility for like an hour or so, and then go back home.
So I have a question. So the thing is, if they're refusing to do the search, then how am I going to get into an inpatient? That doesn't make
right. It doesn't seem right.
it doesn't seem right. It isn't right. So how am I going to get into an inpatient facility? And those last three, I know he didn't call.
When I scanned his note, I did not see them listed.
I know he didn't, because I found those.
Right. For some reason, like you said, Dr. Smith, the powers that be, once they have identified a facility that's accepted you, that's at the appropriate level of care, if you refuse that, then they try to push for discharge.
Which is totally unfair, because that facility they're trying to push me in is not medically sound.
Well, we've talked about it. I know.
Yeah.
I know.
It's not medically sound. So I told them that.
Yeah, and they are reviewed by regulatory agencies, and
I don't care what they're reviewed by. They can't sit there and say they scanned all the patients that go in there, and then you got people coming in and out of there visiting them, and you don't know what they're bringing in.
I 100% agree that there's no way to screen for 100% of infections in anybody at any moment, including in a facility.
Yeah. So I'm not going to subject myself to that, because I'm being bullied. My hands are being tied. I mean, that doesn't make sense.
I feel for you, and you've been very consistent with that too. You and your husband both. Very consistent.
We've been very consistent. I can understand if we were not cooperative, but we have been cooperative to the key.
And you've been consistent.
Exactly.
Right? Like, this is our request.
So, I mean, they have a discharge, and will they extend the discharge to Tuesday so I can have a day to try to get?
I've never had one of my discharges appealed before, to be honest with you. But my understanding is that it comes down to the insurance at this point, like insurance coverage. Once a discharge order is placed and the appeal fails, then the insurance company typically doesn't cover after that.
Right.
That's the big thing. I mean, that's the line in the sand.
Right. And then I got a question for you. So if you guys, right, if there's a procedure that's necessary, y'all do it, right?
Yes.
Okay, and if there's a procedure on a patient that's vital for them, then you would do it, right?
Yes.
So this is the thing. How is it that they pushed to discharge me yesterday, right? And this is all during the morning, but at 4:45, 5 o'clock, they're doing lavage,
Yeah.
which is vital.
Right. And which is good that you receive that service. And that's a service that helps you, helps the wound heal. I see what you're saying. To your point is that if the therapists are deeming that continued lavage is necessary, then it should be that continued hospitalization is necessary. But
Right.
I know, but then, which I agree.
Because they were doing more than just sucking it out. They were cutting out dead tissue.
And they had their notes in too, and I imagine that the people who reviewed the discharge order and processed the appeal saw that, and I've definitely seen your trend during this hospitalization that you had the infection, the infectious disease team was consulted, you had the local measures, you had the systemic antibiotics, you got better, your wound looks much better. I think you'd agree with that. You have told me that before. It's just, this is the fork in the road. For some reason, there's pressure from the hospital to move people to a rehab facility once one has been identified, with the plan for the continued wound care to take place there. You know, people have to go home. We do coordinate home health services as well, but I think you've talked before about how you feel like that's suboptimal.
But yeah, we don't have home health service.
And you're saying that it wouldn't be frequent
Yeah,
enough.
it wouldn't. Hold on. I'm gonna try to get my husband on the phone. Hold on. Because I'm pretty sure he knows. This phone is not working.
It's definitely not working. Let me unplug it and plug it back in.
Okay.
Do you have your cell phone? Is it available?
Yeah, but it's been acting up.
Maybe that did not do the trick.
It did not.
And now there's still no ringtone if you'd like to try it again.
And that, I need to call, I don't know. That's crazy. Okay. I mean, I don't know what else to say, but you know, this is unbelievable.
If I was
It really
in,
is.
yeah, it is.
Well,
If I was in your shoes, I would do whatever it takes to continue getting wound care, whatever that means. But the reality
what
is,
does that mean? I mean, I can't get any care from anywhere.
I mean,
And then the thing is, you know, they're pushing me out. I can't even walk.
right, physically they can't push you out, no way.
Oh, wait a minute, man. Hello? Hello? Hello?
It's on the threads.
Yeah. You were saying what now?
Just if I were in your shoes and I had a wound, I would do whatever it takes to get the wound care. But at this point, you know, once the discharge order is placed and the insurance company agrees and the appeal has fallen through, then there's nothing I can do right at this point. So I'd make it worse by unplugging it and plugging it back in.
No, that it means it's working. Hello? Hello? Let me try and dial out.
Okay, sounds good. Maybe it is working, just no dial tone. Working? No.
No, it's not working. What's it gonna say? So, basically, so the discharge is for when?
The insurance company will not cover the hospitalization starting tomorrow, is what usually happens in this scenario.
Tomorrow after, I think, yeah, after 12 or something like that. Yeah. I'll,
My phone.
I mean, I'm, hello? I'm just, I'm at a standstill here because I don't understand how I'm supposed to get into a rehab if they are not willing
To help you.
to help me. So, I mean, what do I do in that case? I mean, what is my right?
Right.
Because,
Right.
I mean,
So what I would do is call the patient advocate, honestly, in this situation to answer that question. To see what
and
other resources
they're not
we might
here.
have. Right, 'cause it's the weekend.
Yeah.
I have that phone. Would you like me to just unplug it?
Yeah,
Okay.
please.
I'll tell the nurse to get you
Hmm. So,
in.
call the patient advocate.
And Simon's not here, so I could talk to whoever's the on-call social worker at this moment, see what they think. If there's something
Is
else we
there an
can-
on-call social worker today?
Over the weekend, they rotate coverage for the entire hospital on like a every 2-hour basis, so I could reach out to that person.
Okay.
See if they have any
Yeah, I
ideas.
would like to talk to them because, I mean, I can understand if I wasn't fine. And
You identified
you-
3 places, and for whatever
And
reason,
exactly, and they denied the places. They wouldn't call. They said they weren't going to call. I mean, why would they do that?
I don't want to speak on their behalf. That's a good question.
I mean,
What
why
Si-
would you do that?
what Simon told me is he spoke with his supervisors, and they said that, based off of their conversation with Dr. Smith, they do not want him to do that.
Yeah, Dr. Smith is, I'm not gonna say. I mean, this is unbelievable. Really it is. It's unbelievable. I mean, you have a woman here with a hole in her behind.
A chronic wound.
Yeah, exactly. A chronic wound. And can't walk, has a mess, and then just charge her home.
I know.
No home health care.
We can do home health care.
I need 24-hour care.
Yeah, that's the home health agency.
Home health
typically.
agency come once every other day, if that. So that's not health care. That's not home health care. My wound has to be changed every 12 hours, so I need help with that. I mean, do they consider any of this stuff?
They must have, and they do. They have to for each patient. I don't know. At some point, they felt that your husband should be the one to change the wound.
But the thing is, my husband
Works.
That's number one. But my husband is not physically able to care for me. We were hit by a semi truck. Okay, so like if I have to roll over, he can't roll me over because guess what? He'll pull me and he'll pull his back. If his back is out, what's gonna happen to me?
It doesn't feel right discharging you, but my hands are tied. I'll make phone calls. I'll call the on-call social worker, see if they have any other ideas. Dr. Shaw did prepare your discharge medications. I'd like for you to leave with those in hand, including the blood thinner, of course, blood clot.
And where is that?
Typically what the pharmacists do is they fill the prescription, and on the weekends they place it in the vault, and then the nurse has to go retrieve it. So you'll leave with it in hand.
And then, so how about the supplies to clean my room?
Typically the home supplies are coordinated through home health,
I don't have home health. So, I mean, how do I get supplies?
I know the impression that Dr. Smith was given was that you didn't want the home health though.
I told him I need 24-hour care. So, I mean,
Would you be interested in going to like a long-term nursing facility?
long-term nursing facility.
Like a nursing home?
I mean, if I had to, I would just go there.
Do you think you're at that point right now?
I feel like I'm at that point right now. I mean, I can't care for myself.
Yeah.
And my husband really can't care for me either. It's not the ideal thing that I want to do. I'm 51, and well, what the heck, I want to go to a nursing facility. But if that's what I have to do, then I have to do it.
All right, well, let me see if I can talk to Dr. Smith, maybe get that discharge order out then. I gotta talk to him. I don't know.
Yeah.
Because I mean, you've convinced me every time I see you that it's not the best thing. I wasn't here for the conversation with Dr. Smith, so I'm not 100% privy of everything that was discussed, but as I understand it, you know, you're accepting the lavage, you're accepting the wound care, right?
Right.
You're benefiting from it.
Exactly.
The only thing is just that shared room. And I was looking at the notes too, and they said there's a chance they have a private room, but they just can't guarantee it, is what they said. So it's like a timing issue.
I mean, that's like playing Russian roulette.
Yeah, I know. Like, for me to say, okay, good luck over there, and then you go to a shared room, then what are the odds? 50-50?
No. And then so every place that I gave you, they have private rooms.
There you go. So if they were to accept it, you'd be willing to go.
So how am I supposed to even?
Exactly. Like say you do go today, like what's the next step? How do you get your foot in the door there? I write a referral for you. Good luck with that, because that's not the typical process. I can write a referral or an order, but what they'll need, what they really need, why the typical transfers from hospital to rehab is they need updated OT notes or updated PT notes. And if you're home not being evaluated by PT and OT, then they'll say, okay, we got the notes from Emory Midtown, and they say yes, at that time there was a need and an opportunity for benefit from therapy, but is that need still there? We don't know, so we're going to deny you.
Right. So that's why I'm saying, you know, I need that time to put the referrals in to see if I can get accepted, and then I can leave. But I mean, it's going to be for naught if I go home.
Yeah, you have to be convinced. Okay. Yeah. You've identified 3 facilities. They're all private. They meet your criteria. They're in a location that's okay for you, and you're flexible with the location too.
Yeah.
There was, so I will do those things. I'll talk to the social services, the person's on call now. I'll call Dr. Smith if he's available. And talk to him about maybe pulling the discharge order out, which then would make the insurance appeal and all that moot. And then we just have to hang out tomorrow, because it's the weekend.
Right.
And then
just
Monday.
at least give me a chance. I can.
Otherwise, sorry to interrupt you, but otherwise what it looks like is you go home, you go to an ER, and either you're too sick or you're not sick enough. Right?
That's what happens.
Yeah.
And then the thing is, if I go home, what's the probability that this is going to get infected?
Right.
Because we don't know how to care for this. My husband has no training to take care of a wound.
I can't let you go. It doesn't feel right.
Okay. Well, talk to the social worker, see if, Dr. Smith, get full of the discharge. I mean, I'm not trying to stay here forever, but I'm just trying to get a fair chance.
I'm with you. Sorry you have to advocate for yourself like this, but you definitely have to be convinced at this point. So whatever bad things may come my way, which I think they would pale in comparison to the potential bad things that can come to you, namely infection, I'll embrace those things and just talk to Dr. Smith until I'm able to get the discharge order out. And hopefully your insurance company will cover it once the discharge order is removed, because then I'll document in such a way saying, I think that there's a risk if she goes at this point, a risk of readmission, a risk of other things, infection, and I'd like for us to pursue these additional resources if possible.
Okay.
Okay.
All right. Well, thank you, Dr. James.
You're welcome. And again, sorry that you're in a situation where you and your husband have to advocate for you so fiercely.
Yeah,
It must be exhausting.
it really is. And I'm very stressed and I'm very scared right now.
Well, I'll plan on seeing you tomorrow, and I'll let the nurse update you about the discharge order.
Okay.
I'll talk to her, and maybe 30 minutes from now she'll have an update for you. Okay. All right.
All
I'll ask her
right.
to get you a working phone too.
Yes.
Yeah.
Thank you.
All right. I'll plan on seeing you tomorrow.
Okay. Thank you.